How does an STI swab test work? Imagine you're getting tested for sexually transmitted infections and wondering exactly what happens. Well, an STI swab test involves collecting a sample from specific areas of your body where infections might hide. A healthcare provider uses a small, sterile swab, similar to a cotton swab, to gently gather cells and secretions. The goal is to pick up any bacteria or viruses that could cause infections like chlamydia or gonorrhea. For women, the most common sites are the cervix or the vagina. The provider inserts the swab into the opening of the cervix or into the vaginal canal, then gently rotates it against the walls for about 20 to 30 seconds. This helps collect enough cells and mucus for accurate testing. Sometimes, women can also do self-collected vaginal swabs at home, following instructions on how to insert the swab safely and effectively. For men, the swab is usually taken from the urethra, which is the tube that carries urine out of the bladder. The healthcare professional gently inserts the swab into the urethra about 2 to 4 centimeters and rotates it for at least 10 seconds. This method helps gather samples from inside the urethra, where infections like gonorrhea often resided. Other common sites for swab testing include the throat, known as a pharyngeal swab, and the rectum, called a rectal swab. These are important if there has been oral or anal sex, as infections can be present there too. Once the sample is collected, the swab is placed into a sterile transport tube containing a special medium that preserves the sample during transit. The sample is then sent to a laboratory, where advanced tests are performed. These include nucleic acid amplification tests, which detect the genetic material of bacteria or viruses, or cultures that grow the organisms to identify the infection. Swab tests are quick and usually cause minimal discomfort. They are safe and highly accurate, especially for detecting certain infections more reliably than urine tests. Self-collection options are available in some clinics and at home, making testing more accessible. When done properly, they provide a reliable way to diagnose infections early. Getting tested regularly is important for maintaining sexual health, especially if you have new or multiple partners. Early detection allows for prompt treatment, reducing the risk of complications and transmission to others. Always consult a healthcare professional for personalized advice and to determine the best testing approach for your situation.